here. Jessi, welcome to the show.
Thanks for having me.
I went and I did some research before you came on the show, and I went to your website, which is fantastic. And I watched, you have some like compilation videos of all the news, MSNBC. You've been on a ton of news programs, especially during the pandemic. And the one that when I knew, because generally when I'm doing a little bit of research on my guests, I'm like, am I going to like this person? Are we going to get along? Or how are we going to gel? How am I going to make this work? I felt so at ease with your just philosophy on life. I think what really made me feel very comfortable was when you went on, I think it was MSNBC, and they were asking, something came up about people going out to bars and spreading it. And you were like, these people need to feel comfortable and they want to be around people that they love. And I understand that. And I'm not angry with them because this is how certain people cope. And I was like, all right, she gets it. She understands. Like, she's not angry. She's looking at things in a different perspective. You're wearing the other shoe, right? And that's really when I was like, that's because that's what I do that a lot myself. And so I just wanted to, I'm glad that you were on a lot of these news programs during that time to kind of help people understand. So I want to thank you for that. That was awesome.
Oh, yeah, thanks. I mean, it's interesting when you do work in a population that isn't usually on the news all the time, and like healthcare workers and college kids, honestly. And then the pandemic has been so hard on both populations, and people look for people to talk about it. And I just happen to be one of those people. But I also think like kind of what you're talking about, like when you study any sort of mental health profession, you basically assume that anyone can be your patient at any time. So the point is not to make people scared to see you for whatever reason, even if at the core you politically disagree with them. I think that there are people that maybe over time that becomes harder. But I do think at the basic, like human level, when people have trouble with things, it's often because they went down an emotional rabbit hole about it. And they found articles that support the way they feel, right? So if you're angry that you lost your job, you can go down a emotional rabbit hole about how masks are the reason you lost your job. And then you're not going to be in favor of masking, right? So it's very easy to get pulled into that without really doing it from a place of like anti-medicine, though I think some people do. But I think there's also just an emotional realness to how people get put in those situations that I believe pretty strongly in. And I try to do my best to understand.
Absolutely. And another thing, just in reading a little bit of your work, I like how you normalize, like emotions are normal. Feeling this way is normal. And I think that a lot of like, because the way I see our society is I feel like the mental health is definitely a giant issue. And I feel, I have, I guess, my own worldview of maybe what's wrong and how we could fix it. I think that discipline, eating correctly, working out, getting outside, and spending time with the people that you love, and minimizing your screen time, I think that's what's helped me. And doing activities for your yourself, whether it be reading or self-development. Like, I'm a really big on self-development. If I'm not moving forward, I feel like I'm stagnating and I'm going to die and I'm a failure. So like that's where I'm at. But I'm wondering, like, what can we do? Or I want to get your thoughts on two things. Like, one, do you think, as a psychiatrist, do you think that social media is at its core maybe leading to the degradation of our society? And two, how can people mitigate that?
That was a deep way of saying it. You're like, is social media the devil? I think it's really interesting. So I'm a healthcare worker who's also on social media. So I have a different perspective on this because I've actively used most sites. So I know both how much they pull you in emotionally, but also where the benefits are. I think that the data is pretty mixed, honestly. Like, I think you'll find a study that tells you social media makes people depressed and anxious, but you'll also find a study that says people who are depressed and anxious use social media to have social support, and that's also true. I think that the data on self-esteem is probably the strongest. So like Instagram and having like sort of curated life that's not your real life affects people's self-esteem, especially people who are struggling with self-esteem to begin with. I think that makes sense and has been pretty much consistently proven over time. Whether it affects like mood disorders or anxiety disorders is a lot more complicated. I feel like for me, especially over the pandemic, when they took away socializing, that social media was very important. And I felt the same with my patients, that when they were not going to class in college anymore, that being able to interact with their friends over social media or gaming, honestly, like multiplayer gaming, they were able to feel like they were still socializing in a weird but different capacity. And I think it does have benefits there. I always say, and I think it's important for everybody to realize that like it does affect you though. And so I often tell you, like, tell my patients, tell myself to check it, right? So like if you're on Twitter and you're grinding your teeth nonstop and you're getting super angry and you can't stop looking at stuff, like stop and say, whoa, I'm getting angry, and realize that that's probably because of Twitter, and take a break. I think it's really important not to do right before bed. It's very tempting to do because it's a small screen and an easy screen, and we use it for our clock most of the time. But yeah. I think it's really important to be like, this is bedtime. Not only does the screen affect your bedtime, but the whatever information you're reading, if it's the world right now, is a lot, right? So that's going to affect you getting to sleep because you might feel more anxious. So I've personally really tried to do something else right before bed. I'm not a big meditation person, but that works for a lot of people. But for me, it's been like, can you read something that's light? The kind of stuff you might bring to a beach that has nothing to do with the things that like are mental health related, which I actually like, or advocacy related, which I actually like. But can you read something that just is very not it's just not gonna make me worse? And I think that's important. It might not be the same thing everybody does. I think audiobooks are good for that. Podcasts are good for that. But doing something before bed and realizing it affects your bedtime is important. I think some people also will feel better if they set like boundaries around it. So I know a lot of people who don't touch it during the workday. It is very hard to do that. But I think that, people will move their phones or put their phone somewhere else, or try to put blocks on the social media platforms or your computer so you can't access it. You can do all of that. You can also track how much you're on it. But it can just be helpful to start with, I'm not going to use it 30 minutes before bed. And I'm going to pay attention to how my mood is when I'm using this. And if I feel my mood is worsening in any capacity, I'm going to step back.
Yeah, that's pretty solid advice. I definitely do that in my own life. I will not allow phones. Me and my girl, no phones in the room. Like that just, I don't know. It's just too big of a temptation. And I'll go down rabbit holes of looking up weird things about, I have no idea. You name it, I'm probably going to like Google it and start reading, and then I'll end up staying up till 4, and it'll ruin my life. I think a good place to go from here is really kind of back to the beginning. I want to know, how did you get started? Like, what made you decide to want to be a psychiatrist? And like, is this something that you've always been interested in?
So it's a good question. So I think I was like the kid who was good at science, who thought that meant you should go to medical school. And so for a really long time, I just figured I'd go to medical school. In college, I was an anthropology major and I did a master's in anthropology as well. And I think that made me start the conversation about the social sciences, have more of an awareness about cultural and societal influence on health and that sort of thing. So I started thinking about it then, I would say. But when I went to medical school, which I still went to because I thought that's what you do when you're good at science, I didn't want to be a psychiatrist because my father is a psychiatrist. And so I was just like, I like the brain, like maybe I'll be a neurologist, and that's that. And then like literally everything I did, I felt much more drawn to psychiatry. Like I liked how much time they had with people. I liked that like the social history was important to who they, how they presented. And it wasn't just the diagnosis that we were really like curious about. It was like the whole picture. And the psychiatrists were the people who were also writing and also doing different things. So I was like, I can have a weird career in medicine, in psychiatry. It seems flexible. And at the same time, I get time with people and to like really concentrate on them. And I think that was really important to me. And it doesn't exist a lot in most medical fields anymore.
No, definitely not. Now, forgive me of my ignorance here. Are there different like fields of psychiatry? Are there's a child psychiatrist, and then an adult? Is there like, do they? How does that field kind of break down? I have no idea.
I wouldn't call it ignorant. It's super confusing. Like, though people use the word therapist and it's like 75 different degrees that count as therapists. So I completely understand how it would be confusing. So for people who don't know, psychiatrists go to medical school. If that wasn't clear in what I was saying, part of the reason that's helpful is we prescribe medication. So no one else that is in mental health can prescribe medications. Part of that comes from our ability to understand the rest of the body and how it functions, and also to rule out the rest of the things, right? So medical diseases can look like psychiatric diseases and vice versa. They sort of play off each other, and like the mind brain connection, kind of like mind body and how that relates to each other, right? Like people with chronic pain, sometimes that leads to inflammation and that makes you depressed, et cetera, et cetera. But because we understand all of that and we went to school and had the same basic background as like someone who went into surgery, I can be able to say like, okay, I kind of remember that. Let me look that up further and I'll understand it more, or I'll know what stuff I need to really be looking for because I see a lot of the same overlaps over and over again. And I also can say like, okay, this person's on these meds. Do they interact with the meds I'm trying to prescribe? And how do I know? What do I need to warn them about? And stuff like that. So that I get from being in medical school. In psychiatry, you go to 4 years of residency. So everybody does 4 years of training after medical school. And then some people do an additional year or two of what's called a fellowship. That's the same in every specialty. Like you could go to general surgery and then do another subspecialty within that, like GI. And that's like another fellowship. Sometimes surgical ones are just another 3 years. But in psychiatry, you can do 1 to 2 year ones. Most of the time, like probably the most popular one is what you're talking about, like child and adolescent. That's 2 years. But people also do addiction or consult psychiatry. Like if you're in the hospital on like a medical floor and you have something psychiatric related, those people are consult psychiatrists. Or people will do forensic psychiatry. So like the people that testify in court about people's mental stability, for lack of a better word, is forensics. And we don't learn a lot about forensics in residency. We have to be exposed to it, but I certainly wouldn't feel comfortable doing that as my job unless I had time. So they get some time to focus on that. Like I didn't do a fellowship, but I sort of have fallen into the things I'm interested in because I'm interested in it. So like when I was in residency, I knew I was interested in college kids. I love college kids as patients. There's a lot of mental health stuff going on in college. It's the first time a lot of things come out too. So like bipolar disorder, schizophrenia. But I was like, do I need to go to child and adolescent training to see college kids because they're just past it? Like they just don't count anymore, right? And a lot of people will argue yes, because there's a developmental aspect that would be helpful in college kids. But I just argued I'll go work on a college campus and figure it out from there, and just saw a lot of patients and figured it out from being around people. And the same with physicians or healthcare workers. It's really just been something I've been interested in. My master's thesis was on pre-med as a culture. So I've just really been interested in why we do what we do in medical training and how we got here for as long as I can remember. And that has led me to seeing healthcare workers as patients too, which I think is helpful.
Yeah. Healthcare, it's trash. It is the worst. It's trash. It's pure. I mean, I'm dating someone that is a healthcare worker, and it's just complete trash.
Do you get to see them?
Do I get to like? Well, I live with her, but like I said,
she comes home because that's the thing. Like I see a lot. So I also see spouses, right?
Oh, I see what you're saying.
It's very hard to be in a relationship with someone in healthcare, particularly if you're not in healthcare, because it's just really consuming, and the stuff we talk about is not.
It's fucking awful. It's the worst. It's the worst. I couldn't do that. You're never appreciated. enough, right? And your job is to help people and to like be there. And you see people in the worst states. As an occupational therapist, she'll see people that have MS, and that they're dying, and their husband is not able to understand that he doesn't maybe want necessarily this person to go on hospice, as an example, because he's in love with her, and like she's having to explain like this is the fuck that I would never do that as a profession. I just talking about it sometimes on the phone. She'll call me and I'll listen, and then I'll be like, I'm too depressed right now, this is too much, I'm sad, like this story, how, and you've got to go see someone else that's gonna die, like no, I don't know how you guys do it. I couldn't do it. I was a business guy. I went to school. I have better benefits. You make more money. It's just like that. I don't know. You guys are crazy. You're crazy a lot, for sure.
I went to Penn undergrad, so all my friends are in business, and they went right into work instead of all the training in school, and then they make like 4 times as much as I do. But I mean, someone's got to do it, and like we get really. It's really bad, but we get accustomed to those hard stories and we learn to deal with them. Sometimes it becomes too hard, and that happens occasionally. Sometimes our life interferes and that makes it harder to deal with. But for the most part, like, I'm very used to hearing the hardest parts of people's life over and over and over again, and not feeling bad about it and feeling like I could do something to change it. And I think that's sort of part of it, is like, we can help, which is like a lot of people with like things like in the news right now feel very much like they can't do anything to change it. So it feels very like numbing. But for me, it's like, that's kind of just like a horribly sad story, but at least I listened, and I was the first person to listen, or I was there for that person through that. At least I could do that for them. And so it feels like it gives you some sort of agency, even though it's really horrible, because you're helping.
Yes, 100%. And that's cool. And what would you say to the people that are? I mean, hopefully, I don't think my audience is really watching that much news. We've kind of, I feel like if you're tuning into this podcast, you've kind of like shed all of those things. But if you are watching news, like what I realized a long time ago with that is there is nothing I can't do about it, and the only thing that I can control is myself. I can control what I put into my body. I can control the effort that I have, and I can control my attitude. Everything else that's going on that I might not agree with or that makes me sad is just noise and distractions trying to knock me off from my goals, and or excuses for me not doing something, right? Because I pay attention to those things. So like,